This video will discuss the emergency procedures for 3 common respiratory conditions. These include asthma, bronchospasms, and chronic obstructive pulmonary disease, also called COPD. By the end of this video, viewers will be able to identify the extra and intraoral characteristics, understand the treatment and prognosis, understand the process and order of care that dental professionals need to follow in order to provide proper care, and understand how these conditions relate to dental hygiene. Respiratory conditions are very common among the Canadian population, and the probability of having a patient with one of these conditions is very likely. In 2009 to 2010, there were 1.8 million Canadians with active asthma. 1 in 3 of them had their asthma well controlled, and 21.9% of them had asthma symptoms more than 4 days per week. 40% of them experienced asthma symptoms more than 1 night per week. In addition, there were more than 700,000 Canadians that have been diagnosed with COPD. There are thousands more with COPD but have not been diagnosed.
Asthma and chronic obstructive pulmonary disease are obstructive airway illnesses manifested with chronic inflammation affecting the entire respiratory tract. Asthma is recognized as an allergic disease usually developing in childhood due to smoke exposure, infections, genetic susceptibility, low birth weight, and nutritional deficiencies. Asthma is characterized by reversible airflow obstruction following anti-inflammatory treatment. COPD is typically caused by tobacco smoking, developing after the 4th decade of life, characterized by airflow obstruction, resulting in progressive decline in lung function and premature death. Bronchial hyperresponsiveness is the exaggerated response to a variety of stimuli causing bronchospasm. In patients with asthma or COPD, bronchospasms can be induced by stimuli such as pets, pollen, fungus, dust, strong odors, chemicals, cold air, stress, pollution, and exercise. The prevalence of asthma and COPD increases with associated risk factors such as gender, age, BMI, infections, smoking, allergies, pollutions, and environmental toxins. These risk factors can provoke symptoms of wheezing, chronic cough, and declining FEV1, leading to accelerated loss of lung function while exacerbating bronchospasm symptoms. Asthma and COPD commonly overlap due to many common risk factors. Childhood exposures developing into asthma and bronchospasms may predispose patients to COPD later in life. Smoking cessation, oxygen supplementation, pulmonary rehabilitation, and vaccines are all therapeutic interventions for asthma and COPD. A symptom-targeted approach for dynamic obstruction can be relieved with bronchodilators, where inhaled corticosteroids can relieve bronchospasms. Adjunctive treatments such as antagonists, inhibitors, and other pulmonary medications should be administered by a specialist. Although COPD and asthma do not directly affect the mouth and teeth, medications used to manage associated symptoms can contribute to an increased risk of oral disease. Oral manifestations may include xerostomia, increased risk and prevalence of dental caries, enamel erosion, periodontitis, and gingivitis, unpleasant taste, low oral pH, oral candidiasis, and rarely Stevens-Johnson syndrome, constituting a medical emergency. General characteristics may include symptoms such as chronic cough with mucus, shortness of breath, voice impairment, dry mouth, tongue enlargement, gastroesophageal reflux, pulmonary hypertension, peripheral edema, heart failure, and throat irritation. Non-pulmonary conditions may also arise, such as weight loss, muscle wasting, cardiovascular disease, hypertension, anemia, osteoporosis, and depression. COPD is estimated to affect up to 2.6 million Canadians aged 35 to 79 years old, with 50% or more of these persons being undiagnosed. It is the fourth leading cause of death in Canada. While there is no cure for COPD, the disease can be managed with medications, immunizations, and pulmonary rehabilitation. Avoidance of pulmonary irritants improves symptomology and decreases mortality.
The prognosis. Remission rates are relatively low, and permanent lung function impairment may develop in more severe cases or in smokers. Prognosis becomes more poor with patients with permanent lung function impairment, which can lead to hospitalization or death. Death is 2 times more likely to occur in those with asthma, COPD, or bronchospasms due to disease in their lungs. The treatment. For an emergency situation in the dental chair, if the patient is having obstruction to their airway from COPD, bronchospasms, or asthma, we must treat the emergency. We treat the emergency by providing a full oxygen mask for the patient or administer a bronchodilator, which has an immediate effect. Corticosteroids are not appropriate for an emergency situation because they have a slower onset to relieve their symptoms. The dental hygiene process of care for emergencies of COPD, bronchospasms, and asthma are as follows. Assessment. We first want to assess the signs and symptoms of the medical emergency. Check the medical history and medications and determine if this helps indicating the problem. Diagnosis. After assessing the medical history, diagnose whether the patient is having an asthma attack or has an obstruction to their breathing by observing their signs and symptoms. Planning. Instruct patient to bring inhalers with them in order to prevent the emergency, or follow the in-office protocol and have an emergency cart or oxygen tank nearby. Implementation. End dental procedure immediately. Place the patient in an upright position. Give patient a full oxygen mask, and administer a bronchodilator such as beta 2 receptor agonist every 15 minutes. Evaluation. Evaluate the patient's progress and assess the need to go to the hospital or to be sent home. Schedule their next dental appointment after the patient has seen their physician and have given approval to come back.
Information for the practicing dental hygienist. It's important to discuss the oral systemic link. Periodontal infection has been associated with the development of a number of pulmonary diseases, including COPD. Microorganisms from the oral microbiota gain access to the pulmonary tissues and cause infection. Also, discuss with your patient that COPD is a preventable disease. Smoking is a risk factor for COPD. It is important to give your patients the support they need to quit and to help them access more information. Good resources are the Government of Canada website and the Canadian Diabetes Association website. In regards to oral hygiene care, schedule short morning appointments. Use a semi-reclined or upright position, which may make breathing easier. Avoid the use of epinephrine with patients with asthma and COPD. Avoid the use of aspirin because 10% of patients with asthma have aspirin-induced asthma. Additionally, avoid the use of ultrasonic scalers and polishers because of microorganisms from biofilm that can be aspirated into the lungs. In summary, respiratory conditions are very common. COPD is preventable through smoking cessation. Have an emergency cart and oxygen tank nearby. Instruct patients to bring their inhalers with them. Medications used to treat these conditions can contribute to an increased risk of oral diseases.